Here everyone, and welcome to Making the Most of Digitized Healthcare Data, Insights from TBR's 1Q14 Healthcare IT Services Benchmark. Today's webinar will walk us through the recent results featured in TBR's Healthcare IT Services Vendor Reports and Benchmark, and go into detail about what these results mean for your company's strategy. I'm Allison Crawford, and I'm hosting today's webinar. The healthcare IT services market has grown in recent years due to an increasing need for healthcare professionals to digitize healthcare data in electronic health records and an increased emphasis on improved patient health outcomes. These changes lead to a desire for increased use of analytics to capture trends and key healthcare performance indicators in the healthcare IT sector. Over the course of this webinar, Analyst Joe Walent will discuss these market dynamics. But before I pass this over to Joe, there are a few housekeeping items I'd like to cover. First, we're recording today's session and posting it on our YouTube site, TBRI channel. We encourage you to visit our channel to watch this presentation or any of the others that we've posted. Second, we'd like to hear your opinions and thoughts on the materials we are presenting. Please send any questions or comments to Q&A or chat function. Joe will address them at the end of the presentation. Or if you'd like to set up a personal inquiry for more detailed discussion, please reach out to either Joe or myself at the end of the presentation to set up that conversation. Third, we'll send up the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can also find these slides as well as other thought leadership pieces, webinar decks, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight, and we'll share all our social media links to you again at the end of the presentation. Now let me introduce Analyst Joe Walent. Joe is the HITS lead analyst and has been a linchpin in the program since the initial coverage of CSC. His insight into the performance of the HITS vendors have given actionable insight into the business models across the industry and his guidance has assisted countless clients with their strategic planning. And with that, let me hand this over to Joe.
Thank you, Allison, and thank you all for attending today. I appreciate it. And without further ado, we'll dive right in. First, I'd like to take a moment and give you all some background around TBR for those of you not familiar with our practice or our company, and also a little bit more about our health IT services practice. We cover 20 vendors in our IT services, healthcare IT services benchmark. We publish 5 semi-annual reports covering Accenture, CSC, Dell Services, HP Services, and IBM Global Services, and their particular business in the health IT service sector. In addition to that, the other firms that we cover on a quarterly or semi-annual basis are CGI, Cognizant, Deloitte, General Dynamics, HCLT, Infosys, Leidos, and Xerox. And then we also have our benchmark is rigged to exclusively cover the companies of Allscripts, Cerner, CPSI, Epic, Harris, McKesson, and NextGen. By covering on a company-by-company basis and having that company-exclusive lens that we look through, we get a much more in-depth view of how the overall health IT marketplace, and then from those personal or individual company views, we're then able to extrapolate more knowledge as far as or a more granular understanding of the market as a whole, rather than from a top-down approach. And this is one of our TBR's grand distinctions, and this kind of practice is carried out across our overall business structure. So without further ado, let's dive right into today's agenda. So today we'll be covering the key fiscal results from the 1Q14 benchmark. We'll take a closer look at some of the strategic actions undertaken by the various companies covered in the HITS benchmark, particularly M&A, alliances, and portfolio additions. And then we'll finish out with where's the market headed. So the basic environment for the overall healthcare environment is we're seeing greater levels of maturity, especially in the provider set. Companies that are looking to provide healthcare services directly to patients, the providers, are indeed becoming more familiar with the tools and strategies they wish to employ in healthcare delivery, especially when managed from the IT side. The other piece that we're looking at, but one of the big things that these companies are looking for is an immediate ROI on their IT investments, looking for both operational savings and efficiencies, as well as gaining those insights from analytics and any big data tools that can be applied. We'll jump right in on that. Now, the overall market, you can see from the graphic that we've put up, is that we're seeing a steady, albeit slow and decline in the overall growth of the health IT services market. Now, we attribute this to several factors. One of all is the overall size of the market has grown such that to maintain that higher level of growth would be, it would have to grow exponentially, and we're not seeing that type of growth at that point. But one of the other areas is that there is some drop-off and decline in the availability of funding from federal subsidies and incentives for the implementation of health IT services systems, particularly in the EHR, along with under the American Recovery and Reinvestment Act, which was designated as high-tech, and then the completion of a lot of the initial stand-ups of the state-level health insurance exchanges that were put out as required under the Affordable Care Act. Now, these two pieces came together and actually created some additional downward pressure. A third piece is that some large-scale acquisitions of companies we feature in the benchmark have been flowing off the balance sheet or out of the P&L as far as from their distance in the past. So both General Dynamics IT with their buy of Vangent, and now also with CGI's purchase of Logica, significant purchase on their side, are beginning to pull back on the overall level of growth, and so we're seeing some leveling out. Now, we expect growth for HITS revenue as far as the overall market to be in the mid-single digits. We're looking at about 5.0 to 5.5% for the full year of 2014. We feel that this is still a very attractive market overall. Our internal assessment of the more general IT services market revenue growth on a TTM basis shows further deceleration, and it's in single-digit territory down at the lower end. We had it at 1.1% year-to-year TTM growth for 1Q14. So HITS is still a much more attractive market, and we see that many more of the providers are trying to increase their exposure to this market either through a variety of means, M&A, also with internal development and alliances. So the other thing that we need to keep in mind is that certain subsegments within the health IT services will certainly show more exceptional strength. As far as predictive analytics is one such area, decisioning tools, telemedicine solutions, and also population health assessment tools created by health IT service vendors will be in strong demand and certainly outpace the growth that we're predicting for the 2014 year. Now, turning to some individual company performance, I'll help orient you to this graph. Along the bottom, we have the healthcare IT services revenue TTM growth year to year, and then on we have operating margin TTM growth on the other side. So that's the operating margin on a 12 trailing month. To the right-hand side of the graph, we see the outperformers, and to the left and lower quadrant, we have the laggards, as we saw. So to give you some outline on some of the strategies that are being employed. So the Infosys, Cognizant, and HCLT, the Indo-centric companies that we track within the health IT services benchmark, they really were exceptional in regard to their use of effective use of offshoring. Now, this limits them as far as what medical data they can look at. So this keeps them focused primarily on the payer and also the life sciences side of the business where they've built out. And they have strong application development and maintenance as well as industry-specific business process outsourcing solutions for those two sub-segments of the health IT services sector. We're seeing some increased leverage of outsourcing by life sciences companies. There has been a drop-off in some of those blockbuster drugs, so cost efficiency is more and more a strong area where they're looking to control costs, and that is a major driver for these Emphasis, Cognizant, and HCL. The two pure plays that are featured in the outperformer category, Epic and Cerner, both have strong operating margin and have been showing significant growth as far as the implementation of widely accepted health IT service systems, especially in the EHR and medical practice management, RCM pieces. Now, while we expect this will have some downward pressure with the subsidies that are being withdrawn, at the same time we feel that many times these premium or higher end products are being sought after now after providers have initially gone with what might have been a lower cost solution in their initial go-round as far as moving to a digitized health record setup. So we continue to expect to see strong performance from these two companies. Deloitte is a up-and-comer in the healthcare IT services area. Their purchase of Recombinant is now fully integrated, and they are using that as far as building out specific services that named Converge Health, and we'll touch on that a little bit later, but that is going to help further accelerate their growth in the health IT services area. And finally, Accenture. Their positive movement has gone from its win of healthcare.gov business in the first part in 1Q14, and also the benefits from a restructuring of their health IT services business. Now, we also have CGI over on the right-hand side. They are benefiting from the Logica acquisition still at this point from a TTM space, but we also would like to mention that the loss of the healthcare.gov engagement, in addition to the non-renewal with the Massachusetts Health Connect, are both going to provide some exert downward pressure on the growth area for CGI, and we expect to see them moving continually more towards the center area of the chart where the largest grouping of providers is. Now, looking at the laggard side, we have Leidos furthest to the left, and this is since they spun off from SAIC, this has been a area where they was initially expected to show some strong growth pattern for the company, but as of late really been not performing as well as projected. We feel that some of this is due in part to the longer decision cycles that are occurring at the federal level, and also some pullback from those initial consulting and implementation engagements for health IT services for the electronic health record. Harris has had continued problem with its federal exposure, but we do believe that the launch of their Fusion FX in the most recent quarter, 1Q14, will certainly act as a growth engine for the company and help to offset some of that pressure that they've been getting in the federal space. And finally, Allscripts has been going through some restructuring and internal consolidation activities, creating some estimated operating losses for the IT services part of the business. But we're also registering renewed demand. We see an expanding pipeline of business, and also their efforts in the cloud area, as well as their alignment with other providers to bring their distinct and client portal-oriented and cloud-based services to market as a true plus. So from that standpoint, we're looking at the top and bottom of the market. It seems that those companies that have a little bit more niche focus are doing very well. The ones that are not have much kind of a broader, less defined focus area, in some cases, barring Allscripts, but not having as much cloud exposure, are failing or not doing quite as well. We'll look at some of the top growth leaders that we had in our most recent report. And what we saw across in that category was going into new segments and also international opportunities were areas where these companies were able to accentuate their growth and really bring it to those positive strengths that they have to bear. We covered Infosys in the previous slide, but just to reiterate, BPO and IT outsourcing have both been strong offerings, especially in the life sciences sector, and they're a lot engagement with Washington, D.C. Last year for the establishment of the Health Insurance Exchange, and then the renewal announced in 1Q14 will continue to give them strong growth in this area. CGI, as we said, the Logic acquisition is still giving it a little upward boost, somewhat of an upward boost as far as overall growth on a TTM basis, but we expect the loss of healthcare.gov and Massachusetts Health Connector engagements to exert more downward pressure in the coming quarters. And finally, but on the other side, the integration of Logica has come and is beginning to bear fruit. They've had some wins in the UK and are making strong headway in Northern Europe. And finally, Epic, a recent addition to our overall benchmark, but it has been its overall focus on the higher end in your large health systems continued to make it a sought-after company. It has a very well respected and established brand, and it continues to trade on this very effectively, and it continues to bring them estimated growth in the top 3. We also had Deloitte, Cognizant, and Cerner in the top category, and we'll just be looking at them in future quarters, I'm sure, in a little bit more in-depth basis. We'll turn now to the profitability leaders for the quarter. HCLT, its expanded use of offshore labor pools has been a real boon for the company. Also, the introduction of automated service delivery and their real focus on developing additional solutions specific for life science companies have been a real impetus for growth for the company. Again, Epic, a recent addition and to the benchmark, but another strong performance, solid margin insofar as that they limit their exposure to health IT services at the very high end, very value add type level, and instead partnering or giving some of the not as valuable systems integration work to their partners. And in many cases, this is a solid area of business for your consulting and systems integration companies in the health IT services sector as far as Epic implementations for large healthcare systems. And finally, CPSI, a very smaller player in terms of revenue, targets the rural and country smaller hospital systems in the U.S., but has, because of this niche focus, has been able to develop effective methodologies to implement their business and really be able to secure strong profitability at the operations level. So this is a performance that we expect to continue across all these companies. Some of the other players that we see popping up in here is Cerner, which is a similar business model to Epic as far as maintaining its focus on the higher end, more higher value work that it does. Cognizant with its life sciences and payer piece of business, as well as its effective leverage of offshore business and offshore labor, and then finally emphasis with a similar model, but also pushing further into the U.S. public sector. We'll look now at the overall segment performance that we have. In the Health IT Services benchmark, we look across primarily the 5 sectors of payer, provider, life sciences, federal, and state and local, as they each have specific trends that govern how business is going in that specific area. The highest area of development, or what we saw as far as the strongest growth area, was indeed for payer. We're seeing that we had estimated 9.9% 12 trailing month growth. A lot of the drivers around this is patient centrism, the need for payers to have a much closer engagement level with their members, looking to encourage or find ways to encourage that positive wellness behavior, effectively, keeping those costs down for the payer in the end. Provider is also second in this regard, and is also seeking to have that higher level of patient engagement. So these 2 areas are a strong area where patient engagement and seeking to have that greater insight into what the end patient or member is doing on a more frequent basis, and also helping them shape their behavior so that they can have more positive wellness and also improved health outcomes. Finally, life sciences, we estimated at 8.6% TTM growth. Analytics is a strong area for this, with the large data sets as far as research and development for new drug therapies coming along. And this is an area where we're seeing, in particular, Dell has been making certain headway as far as they have an alliance with Informatica that's going to complement the StatSoft acquisition they did as far as creating more analytical tools that will be available to life science companies for new drug therapy development or improved overall testing. Federal, on the other hand, we saw grew very slowly in the first quarter on a TTM basis, under 1%, and it was down sequentially. The move of the health IT or health insurance exchange to more of a maintenance schedule, but on the other side, we see that the prospective contract for the Defense Healthcare Management System modernization are certainly ramping up, and already you have teams from companies within the Health IT Services benchmark coming together to compete for this sizable contract, estimated to be around $11 billion in total contract value. Epic and IBM were one of the first companies to come out, but you also have CSC, HP, and Allscripts tying in together to compete for this large-scale contract, as well as Accenture, Leidos, and Cerner. So you have the makeup is with an established CS&I company, along with a pure play in the healthcare IT services space, and we're expecting that this is going to be a hard-fought campaign, but the payoff is phenomenal. So it's going to be a long, drawn-out process in that as a result. And looking at the state level, this was down to 12.7% TTM growth on a sequential basis, down from the previous quarter. But we are seeing that states are looking to, now that they've digitized much of their information, have implemented or renewed their MMIS systems, have this greater level of involvement and people signed up for healthcare within their states. The need for big data solutions is a strong area, and also the need to have analytics run on these to have a better understanding of population health issues and how best to address those, identify areas that would be quick fixes, public health policy, things of that nature are certainly becoming areas where they're looking forward. So with that, we're going to move into some of the areas where the companies were building out and looking to expand their portfolios to have greater reach within and build out those comprehensive portfolios to win clients and provide simplified procurement processes to be single source in many cases as far as solution delivery. So we'll look at how various vendors in our coverage built out their range and depth of HIT solutions and expertise. First up, we'll look at some key acquisitions that we saw. So the two that jumped out were Xerox purchase of ISG Holdings and IBM of Cloudin. So Xerox purchased ISG for $225 million during the 1Q14. This is going to provide Xerox with immediate access in the workers' comp category. With ISG, they get StrataCare and Bunch Care solutions. In first case, StrataCare is specializing in medical bill review. This is also going to help and can probably be applied as far as fraud detection on a much grander scale. And then in the other care, you have care management and analytics from Bunch Care Solutions, and that's going to provide also analysis of what care is being delivered for what problems and having greater insight into how best to work with work comp payers and provide them insight on what how best to structure their business, and also look at ways to structure their policies to better deliver service to the end users. On the other hand, you had and we also looked at the IBM Cloudin. So this acquisition is really going to help IBM's big data and analytics capabilities across the company, but we thought it was going to be particularly applicable in many cases to the health IT services segment within IBM Global Services. It's going to provide greater searchability and tools for developers using IBM tools, and it's also going to allow those developers to more easily manage databases that they're using. So this is from a personal or consumer apps or even a clinical apps development category. It's going to strengthen IBM's overall platform as far as bringing to those healthcare applications to bear. Turning to alliances and the low-cost way that in many cases, this is a very effective way to rapidly build out your reach but also limit your capital investment in those areas. And that's really been the byword for at least CSC in that regard. While the tie-in with Amazon Web Services is by no means exclusive to their health IT services coverage, it will indeed have a strong impact, and it is going to be a critical component in our estimation with their involvement with HP and Allscripts as far as they're putting together a very viable bid for the Department of Defense Health Management System Modernization contract going forward. Dell Services had a very interesting alliance in tying in with Texas A&M, and this, we feel that this is going to give them a lot more special insight, but it's also going to create a real-world test environment at their training hospitals to find new solutions or understand better how solutions could be implemented to better regulate and manage those healthcare processes that are going on. Business transformation services development will certainly be a positive result. And this also spans across all of Texas A&M, so it's not just limited to the clinical side, but you also have nursing, pharmacy, life sciences, and public policy that are going to be affected, and Dell will benefit in that regard. Finally, Epic. Largely, the large system, as we've said repeatedly, it's the large health system provider providing that electronic health system piece. But in this alliance with Apple, There's greater access in helping the individual consumer access their health record, but at the same time also having the clinical side be able to decide what is being written into that record. So it's going to increase the profile of Epic and also give them that greater level of exposure to the consumer market. And as healthcare moves to more of a consumer-oriented business, we feel that this is a strong move for Epic. Finally, some internal developments that came along. We touched on it briefly, but we'll dive into a little bit deeper. Deloitte's release of Converge Health. It's going to give Deloitte a specific business segment or unit that's going to be focused on the direct consulting of service offerings and providing portfolio data-driven consulting to clients, particularly in the provider sector, but also across the other pieces. And it's going to focus on outcome-based solutions, which is certainly something that resonates with healthcare as they're driving to delivery of better outcomes in the healthcare sector. So being able to structure their business to readily move to better outcomes is something that they're very attuned to at this time. Second was Harris's release of Fusion FX. We touched on that briefly as well. And this is another area where a new product is going to provide that higher level of individual patient consumer insight into their own health record. So we feel that the uptake of this in the provider sector will be strong, and it's really going to preserve or provide that strong engine that Harris has been needing to get some turnaround in their health IT service business. Finally, McKesson built out its portfolio, and this is part of its single source drive that it's doing in the marketplace, with a managed mobile services solution. And as far as trying to capture the increasing demand for mobile access and allowing those provider health IT services departments and or their IT service partners the ability to manage access and as far as monitor that access to protected health information. And this will be able to be used in conjunction with McKesson's data management solution. So having that full range of integrated solutions at the fingertips for the end users. So now we'll turn our attention to some of the overall trends that we are picking up on with our company-focused coverage of the health IT services marketplace. And looking at that, first off, we're looking at patient engagement. And this is something that more and more of the health IT service vendors are looking at. They're coming in conversations with them. They're bringing this up more and more as far as how they can create those tools and solutions that will be able to allow providers, payers to have that higher level of influence on their customer set, being the patients or members in that regard. So in many cases, what they're looking for, providers are more invested in influencing patient behavior, helping those patients making healthcare and wellness decisions on a day-to-day basis. And companies like Allscripts, they have a population health management offering. They're also with Sunrise Patient Portal and Follow My Health. There are also ways that individual patients can look at their electronic health record and get a better understanding of their individual healthcare picture and move from there. Also, coming up with personalized healthcare solutions and making sure that personalization of healthcare is certainly a piece that to get that and patient buy-in is an area. And again, Harris's Fusion FX or McKesson's MyCare Plus solution are two examples where having a greater level of insight and understanding of your own personal healthcare and then the providers and the greater healthcare community, your accountable care organization, understanding how best to influence patient behavior for each individual is going to be a stronger piece. So we're seeing that more health IT service vendors are aligning in that. And then finally, we touched on it earlier, but the Epic and Apple alignment to create the HealthKit application, and providing that centralized point of contact where the consumer level of sensor data can be written to the clinical electronic health record at the discretion of the healthcare provider, and having that higher level of interaction between the patient and provider. So in this regard, we feel that the winners in the patient engagement will be those companies that are able to really assist providers and payers in shortening any kind of feedback loop, having that behavior and either the incentive or the disincentive being passed along in a short term to address that behavior as it's occurring is really going to be the area where we're going to see health IT services companies jumping out and standing out among their peers. Another area that we're seeing more and more is convergence and consolidation. And convergence with more payers taking on provider-type business lines, providers taking on payer-type business lines, having that kind of full scope and understanding of their total population and having the benefits and interaction that go on behind that. Companies that are able to understand and negotiate the various legal, regulatory, and simple operational facets of this kind of piece are certainly standing out. And so we're seeing the companies that are with high-end consulting and understanding, the first-rate ways of bringing these things to bear, and also where the rocks are and how to avoid those are certainly the hits vendors that are going to be standing out in this regard. Also, consolidation. We're seeing more and more that the increased level of regulation in the U.S. as far as implementing ICD-10, meaningful use, is causing more and more pressure on some of your smaller providers where they're maybe merging with larger providers to get the access to capital to implement the necessary changes. And that this is a piece where your systems integration players that are in the health IT services are certainly benefiting from. And finally, I'd like to look at the secure communication. So the management of chronic conditions and how this is best being addressed through accountable care organizations. Many of the players, this is going to be a communications and also a cybersecurity play for most of them. So while patients with chronic conditions such as asthma and hypertension, all those where you're looking to influence patient behavior on a day-to-day basis, making sure that they're taking their meds, that they're, after any kind of hospital visit, that there are follow-up and touch points where they're, and having that communication to make sure that these things are taking place. Integrating a full network of patient care delivery is really what it's coming down to. Cerner has an alliance with OTTR Chronic Care Solutions, and they're developing patient tracking capability. Now, this is for, at the very high end, for solid organ transplant patients, but I believe that more and more of this is going to be as far as having that higher level of understanding touch points, in-home care delivery and telemedicine, integrating those pieces together, a larger and larger piece. So from our assessment, we're seeing some of the larger systems, consulting and systems integration providers such as HP, IBM, CSE, Dell, Accenture. They're investing in building out telemedicine and remote monitoring solutions, enabling patients to return home more quickly, which lowers provider costs in many cases, and also remain at home in a lot of cases for care delivery and not have to move into, say, a managed care solution in many cases. And in that regard, we feel that the companies that have that international exposure as well with the model being currently underway in Europe, where in-home care for the elderly, for example, has been very effective in both quality of life for the end patient, but also in keeping costs down as far as care delivery. So with that, I'd like to open it up to questions. I know we covered a lot of ground, and I see that we have several questions coming in, so we'll wait for a moment, and then we'll dive right in.
So, Joe, I don't know if you had a chance to see the questions that have come in. There was one about pharmaceutical sterilization. Do you want to take that one first?
Yes. Okay, I see that now. So the question is,
do you know which of these HIT vendors are strong in implementation of pharmaceutical sterilization and traceability solutions?
I think in this regard, the companies that feel that would be very strong in this regard would be those with strong manufacturing. RFID is certainly a piece that factors greatly into traceability and the actual authentication of many counterfeiting of pharmaceuticals and drug therapies, things of that nature, is becoming a problem as you know, this is an opportunity for countries with less regulated medical care environments are not seeing as much regulatory environment or oversight. So those companies that have RFID experience, also with you know, supply chain management and oversight. So I would, you know, the companies that immediately jump to mind would be you know, Accenture, your IBM, HP, CSC, Dell Services. The CS and SI companies that also have, you know, a wider experience with and lessons learned from other distinct vertical practices.
Okay, we have a couple more questions in queue. The next one, Joe, is you mentioned the DoD Health Management System modernization team being formed. What do you think the wider impact of this engagement will be?
Well, I think that the what we're seeing as far as, you know, and this also reflects on the VA's efforts as well, but and the fluctuations that the VA is going through and how they're going to be addressing shortages in provider or extended wait times, anything like that. I think in both examples, this is going to be the test environment that in the U.S. we can see as a larger or a microcosm of how healthcare is moving in the wider segment. So the movement to greater interoperability and you know, establishing those firm standards across and having, you know, the greater view for the DoD health management system, having more uniformity in how data is going to be moving across is certainly the area that that we're seeing also in the private sector. But I think that this is where it's going to be moving much faster. I think healthcare has been one area, technology has been one area where private sector has been outpacing government in many regards. But I think as far as healthcare delivery, I think this is an area where, you know, there are two ultimate views of how it's being delivered. In this case, we're going to see one such example being played out in the Department of Defense medical health management system modernization contract. So those companies that are vying for that contract, you know, I think understand that it's not just, you know, the $11 billion, but it's also helping shape how healthcare is going to be delivered as we go forward in the U.S.
Okay. So we actually had a question come in later, but it was U.S.-based, so I'll switch to that one. So the next question, Joe, was the overall movement to outcome-based healthcare in the U.S., are there any standout HIT vendors in that area?
I'm sorry, Allison, you were kind of breaking up. Can you?
Sure. The overall movement to outcome-based healthcare is occurring in the U.S. Are there any standout hit vendors in that area?
Thank you. I'd say that this is one of those wide open areas. For outcome-based care delivery, I think that your pure plays are going to have a strong understanding of how to tie the various pieces together. Your systems integration piece with their experience as far as bringing together various systems and intercommunication that's going to need to go on, and also even the endocentric players are, with their ability to, test code, their experience with mobility, also with life sciences, and having that. So I feel that this is pretty much way up for grabs. I'd say that if I was going to put some early bets, I would say that the systems integration, your consulting providers, the Accenture, IBM type companies are certainly going to be, the ones that are initially turned to for helping set up these systems, tying the healthcare system, but also those municipal, state-level agencies that need to be involved, also immediate stakeholders as far as family and having sign-up and engagement at that level. So I think, as far as being able to coordinate and pull all those kinds of pieces together, your systems integration companies are certainly going to be very well positioned.
Okay. We have one more question in queue, so if anyone else out there has any additional questions, please send them through now. So the last question we have right now, Joe, is, in your opinion, who would be a potential disruptor in the HIT marketplace?
Well, I think that this is an area where, with the fluctuations that it's going through, and just understanding how, companies like Walmart and CVS are disrupting healthcare from a provider side with, more of a retail type setting and bringing healthcare to neighborhoods in that regard. I think that there is going to be, a similar type piece coming from the customer engagement, or your CRM, and that is Salesforce.com. I think is a company that is very well positioned to come in and be a major player or a partner in the overall health IT services space. It's a cloud-savvy company. They're customer contact-oriented with the consumerization of healthcare. I think that they really have a strong background as far as, and also creating those personalized healthcare plans, things like that, which, drive off of that customer relationship management. So having that kind of understanding, even at, at a very retail customer level, is certainly going to be a strong addition to any type of electronic health record or patient management type of offering going forward.
Okay, great, thanks. So we do not have any additional questions in queue, so I'm going to talk real slow for a minute or so in case anybody gets a last-minute question they want to ask. And so with that, I'm going to start to shut down the webinar. So I want to thank everyone who spent the last hour with us for your time and for your questions. They've been great. And thanks, Joe, for the presentation. I've already gotten several requests from folks in the audience about getting the deck, and so we will be sending the deck out to you by tomorrow. But if you're a pressing need that you need to see it today, please send me an email, and I will make sure that you get that by the end of the day today. As I mentioned, I'm going to share all the social media links with you, so I do encourage you to follow Joe as well as TBR on the Twitter handles listed here. He is sending out tweets on a regular basis about what's happening in the healthcare market. So if you'd like to follow along what Joe is seeing, please do follow him. And we'd like to encourage you to join our conversations, our social media conversations on SlideShare, YouTube, and LinkedIn at the links listed here. If you have any questions, just give us a shout on one of those, and we'll be able to get back in touch with you. On your way out of the webinar, we do have a short survey. How valuable was the information in the presentation? How good was the presenter? And if there's any other open-ended feedback you want to give us in terms of things we should be covering, things you want to see more of, things you want to see less of, we do take that feedback very seriously, and we are using it to evaluate our presentations and alter them quarter to quarter, because we want to make sure that we're bringing you value for the hour that you do spend with us. So we do appreciate your feedback and look forward to getting that from you. I'm going to leave the chat function open for another few minutes in case there's any last-minute requests for conversations or questions. And if we don't hear from you now, we look forward to speaking to you guys all again very soon. Probably in the next 3 months, we'll do our webinar on our healthcare IT services vendors benchmark. So thanks, everyone, for your time today, and we look forward to working with you in the future.